There's nicotine, and then there's government dependency on tobacco-generated revenue. And it's up to public health to address both forms of addiction.
Let's dive back into a little bit more on your background. You've worked in tobacco control at some high-powered nonprofits, the American Heart Association, the Truth Initiative. Tell us about that. What did you work on?
Sure. I joined the Truth Initiative shortly after David Abrams and Ray Nyara, who many of your viewers will know, left the Truth Initiative. Several of their team members also left Truth at that time. So, I worked to rebuild a health policy research institute within the Schroeder Institute, a health policy research team within the Schroeder Institute. One of the first studies that I did was looking at youth use of Juul. I think I had one of the first peer-reviewed studies that estimated Juul use among young people. I also thought a lot about the potential risks and benefits of e-cigarettes from a public health standpoint. That culminated in an opinion piece that Robin Koval, the president and CEO of the Truth Initiative, and I, published in JAMA that was titled "The Potential Risks and Benefits of High Nicotine E-Cigarettes." And in that paper, we acknowledge that e-cigarettes very likely can play a really important role for adults with smoking cessation, but we were concerned about youth use and youth uptake. And the key question is, what's the balance? Where do we balance the risks and benefits from a public health standpoint? So, that's really been something that I've thought about ever since. And that's what I think that, that we need to strive for in public health, is finding that balance. But I went from the Truth Initiative to the American Heart Association, where for about 6.5 years, I supported the AHA's organization-wide strategies related to tobacco and nicotine. So I helped lead and direct some of these efforts. I helped support some. I was just kept aware of some others. But generally, I was probably the one person at AHA during that time who had at least a general awareness of everything that we were doing across the tobacco and nicotine space. So, I mean, during my tenure there, I worked on a lot of projects. I'll just talk about a couple that I'm proud of, that I thought were, really great opportunities for the Heart Association.